Hi everyone, my name is Gabrielle and today I will be talking about Legg-Calvé-Perthes disease, which also can commonly be named just as Perthes disease or abbreviated as LCPD. I will go over a brief introduction of what this pathology is and what it does, and then I'll share my journal review with you guys. So this condition is a rare pediatric disease that affects the coxal joint at the femoral head. The femoral head loses its blood supply, causing avascular necrosis, which is cell death. Perthes disease is considered idiopathic, so there is no known cause of why this happens, but some research say that it could be a genetic disorder. Perthes disease goes through 4 stages, and in those stages, the blood supply to the femoral head returns, causing the bone to grow back eventually. Some symptoms may include pain around the hip, thigh, or knee, changes in walking or running pattern, decreased range of motion in lower extremity or extremities, and painful muscle spasms. Perthes disease usually affects children of the ages 2 through 12, with a more common appearance in boys than in girls. However, the damage to the femoral head is more severe if found in girls than in boys. In most cases, only one hip is affected, but there is a 10 to 15% chance that both hips could be affected. The first stage that Perthes disease undergoes is the initial phase, which is where the blood supply in the femoral head is low and the bone cells die. This area can become inflamed and very painful in the patient, which may lead to limping. The ball of the femoral head becomes less round in appearance in X-rays, and this could last for several months to even a year. The second stage is fragmentation, where the body naturally replaces the old dying bone with a new softer bone. Because it is a new bone, the new soft femoral head is in a weaker state and is now at risk to break or collapse. The third phase is reossification. This is when the new, stronger bone starts to develop and harden into a round shape again. This is the longest stage and could last from 1 to even 3 years. The healing phase is the final stage. The bone growth is complete and continues to develop until the child stops growing, which is approximately age 18. Some treatments that can help with the healing process of Perthes disease is the use of a cast or brace, such as a Petri cast, which is shown in this picture. This cast keeps the femoral head in its concave placement of the acetabulum, emphasizing it to stay in place. This can be worn up to 6 months, then eventually just at night. Other procedures that may help are an arthrogram, which is an X-ray of the inside of a joint, a tenotomy, which is a minor procedure to release the tightness in the adductor longus muscle in the groin, anti-inflammatory medication, or an osteotomy surgery. There are many factors that can contribute to the number of treatments that are available. If not treated at all, it may lead to arthritis. Physical therapy is an important intervention that can help with the process of Perthes disease. Physical therapy is needed so us as clinicians can help restore muscle strength and range of motion in the affected lower extremity. Most exercises would include motions of hip abduction, internal and external rotation, and we would also address balance, posture, and gait pattern because an assisted device may be needed. And of course, we want to help reduce pain. In the journal I found, a team of experts studied 15 patients that had a late presentation of Perthes disease. This study included 13 males and 2 females between the ages of 8 and 12. The goal of this study was to prove that a proximal femoral osteotomy can change the vascular status of the femoral head and that it can quickly heal even in a late presentation of Perthes disease. Before surgery, all patients had limited hip abduction and internal rotation. 8 out of 15 patients complained of pain at the hip, and 12 out of 15 presented with ataxia. All patients were operated on by the same orthopedic surgeon by VDRO. which is a varus dilatation osteotomy. After surgery, each patient had a gradual weight bearing on the affected extremity. Each patient had a follow-up after 2 weeks of the suture removal, then every 2 months for a year, and then finally every 6 months for 2 years. During each follow-up, the patients were assessed for range of motion, deformity, gait, and limb length discrepancy. This picture shows the progression of this study of an X-ray taken from one of the patients. It shows the late presentation of Perthes disease during the surgery and then the affected femoral head after the surgery. The grading system that was used for this study was called the Elizabethtown classification. It ranks the patient's presentations post-surgery on a scale of good, fair, or poor. Good meaning that the femoral head is fully intact with the acetabulum and no range of motion limitations. Fair meaning that most of the femoral head is covered by the acetabulum and that there are no symptoms, however, a slight restriction of hip movement. Poor meaning that less than half of the head is uncovered and there is a restriction of hip movements. Also, their hip range of motions were measured and then compared to their non-affected hip. These are the results from the study of the affected hip post-surgery. 9 patients had a good outcome, 4 had a fair outcome, and 2 had a poor outcome. Some of the positive observations that were noticed were that there was no pain reported after the surgery, and every child was able to sit cross-legged and do a squat. On the other hand, some patients still had a gait deviation and limited range of motion in their hip. Overall, hip range of motion throughout the study increased, resulting in almost near full range of motion compared to their normal hip. The discussion remains debatable to which is the greatest treatment that gives the best outcome in late-onset Perthes disease. However, based on the radiological and clinical outcomes in this study, VDRO surgery is a strong method to choose because of the beneficial effects. Here are my references that I use if you want to look up more information about Perthes disease. Thank you all for listening.